What is the 6-minute walk test? The 6-minute walk test evaluates the functional capacity of the individual and provides valuable information regarding all systems during physical activity, including pulmonary and cardiovascular systems, blood circulation, body metabolism, pulmonary, neuromuscular units, and peripheral circulation, arthritis, fibromyalgia, geriatrics, multiple sclerosis, Parkinson's, spinal cord injuries, strokes, muscle disorders, spinal and muscle atrophy are some of the conditions that can be assessed with the 6 minutes test. It is a type of exercise test. It measures your ability to walk or exercise. It measures the maximum distance that you could cover while walking on a flat, hard surface over a period of 6 minutes. You should take all your medication as usual or as prescribed. You should eat a light meal 2 to 3 hours before the test. You should not exercise vigorously before the 6-minute walk test. You should wear loose clothing and wear comfortable shoes like tennis shoes. You may use a walking aid like a cane or a walking stick if it makes you feel safer. You may use oxygen if you are used to it. You may need to carry or push the tank though. A technician will explain the test to you and ask if you have any questions. Your blood pressure, heart rate, breathing rate, and blood oxygen levels will be measured before the test. You will have to walk along a corridor of 30 meters. At the end, turn off the path or corridor. You will turn around a pylon and continue walking, covering as much as possible ground in the 6 minutes. However, if you feel shortness of breath, experience dizziness, have chest pain, or feel faint, you may rest briefly before continuing the test. But if symptoms continue, the technician will interrupt and end the test. The technician will not encourage you or speak to you during the test. You should neither speak to the technician or your friends or family. The technician will only inform you about the time, when it is 4 minutes up, 2 minutes up, and finally when it is 15 seconds left. He will finally ask you to stop at the end of 6 minutes. A scale will measure your degree of breathlessness as well as fatigue levels. Your blood pressure, heart rate, and breathing rate will be taken after the test, and necessary lifestyle changes, exercise, diet control recommendations may be given. If you test the first time and then repeat it a month later, there should be some improvement. Better results may ensue after a month. Sometimes the 6-minute walk test can even point out patients who need dire help or hospitalization. A note of caution: if there are any contraindications like unstable angina, a heart attack the previous month, a high BP of 180/100 or above, restive heart rate over 120, then it is recommended not to do the test. Wish you the very best of health. Oxymed Hospitals.